In the last several years, we've known that we have two sets of problems. One set of problems are we have communication failures in healthcare, and those are a major cause of what we call sentinel events. 2/3 of those sentinel events are due to the communication failures. So we know in healthcare we have to do a better job communicating about our patient care. Another set of problems that we've known over time, we have reduced the number of work hours our residents or house staff can spend in the hospital. And now doctors are working less on shift work, but having to hand off about patient communication even more. We have to ensure that the way we're handing off is more standardized, is more effective, and is relaying all that important information it takes to look after a sick patient in the hospital. And so what we did with the IPASS study is come up with a series of interventions that individually have been proven to work, but never all in one package. So we put that together and tested it at several institutions, one of the lead ones being Primary Children's Hospital here at Intermountain Healthcare.
We used the IPASS curriculum to go through the entire hospital to teach on the longer term nurses, and to teach residents, and to teach med students, and to teach families and faculty what we need to get out of the rounding process.
IPASS stands for the series of interventions that we've put together, IPASS. The I stands for illness severity, how sick is the patient, and we want to start with the sickest ones first. P is patient summary, so give us a summary of everything that's happened to this patient and what brought them here to the hospital. A is action list, so what are the things I need to know for my shift tonight? S is situational awareness, so what are the things I should be anticipating and how would you like me to react to that, given that you've been following this patient a lot longer than I have. And then the final S is the hardest one culturally to do, is the synthesis by receiver. So now that I've explained everything to you, read back to that person everything that's supposed to happen, so that they understand that you know what to do in that piece. Now we have IPASS, which is a well-studied, rigorous, in many settings intervention, and we know it keeps patients safe. We have found, the landmark study in particular, finding that we had a 23% reduction in preventable adverse events. The other thing we've measured are what are the impacts to the rest of the system? How long does it take? How practical is it? How easy is it to do? And what we found in all those measures are it doesn't take any more time, it's very practical, and the part that's hard is actually the cultural change. But patient safety is our first priority, and we're up for the challenge.